We'll tell you when to start talking.
Okay, we'll be live soon. Thanks very much, presenters.
Good morning everyone, and welcome to this webinar providing an update on COVID-19. We do apologise about the small technical delay this morning, but we have a number of presenters and people here to talk to you today. My name is Mark Burgess. I'm the Executive Director for Strategy here at the Department of Communities, and today I'm joined by Mike Rowe, the Director General for the Department of Communities, Amanda Pickrell, the Deputy Director General from the Department of Premier and Cabinet, Tudor Codrano, Incident Controller, and Kylie Mulcahy, Planning Lead from the State Health Incident Control Centre, Tammy Matra, Director of Emergency Services, and Natalia Gamel, Project Manager from our State Welfare Incident Coordination Centre here at the Department of Communities, Elaine Patterson, the Executive Director of Contracting at the Department of Communities, and Rachel Seward, Acting CEO of WACOS. We'll be discussing the departments and the sector's COVID-19 responses and preparedness today. And I'll now invite Mike Rowe, Director General of the Department of Communities, to open today's event.
Thanks very much, Mark. Good morning, everybody, and welcome. Thank you so much for joining us. There's almost 600 people are online today, so there's obviously this topic's generated a lot of interest. I'd like to begin today by acknowledging that we're broadcasting from beautiful Whadjuk Noongar Budja here in Ballyallup. And I acknowledge the traditional custodians and their elders past and present, as well as the traditional custodians throughout Western Australia from all of the places from which you are joining us today. I pay my deep respects to their elders past and present. So as Mark said, today is a really important opportunity, obviously very current given the government's announcement last night about the border arrangements. Really important that we have this conversation about our preparedness for COVID-19, and it's fantastic that we've been able to pull speakers from the Department of Health, from ourselves in terms of our work, as well as our partners in WACOS. So I'm hopeful that this will be a very useful seminar for you. Can I just take this opportunity to thank you all most sincerely for the huge amount of work that's happened over the course of the last 2 years that we've been operating in this pandemic, and we'll be operating in it for some time to come. I think the hallmark of our success so far has been the partnerships that have existed between government and the sector, and we need to keep that going, obviously, through this period. So without further ado, I'm going to hand it back to Mark Burgess. He's going to be your MC for today's event. I can't be here for the entirety of the event, but I will be here for much of it. I look forward to both the presentations and to the ensuing Q&A session that follows. Thanks very much for joining us, and over to you, Mark. Thank you.
Thanks, Mike, and just noting that you'll be leaving the session a little bit early today, and we appreciate the time that you've been able to give us. I'd also like to acknowledge and respectfully acknowledge the traditional owners, the Whadjuk people of the Noongar Nation, from where we meet today in lovely Walyalup down here in Fremantle, and pay respects to them as the traditional custodians of this land and recognise their traditional connections to land, families and communities. I'd also like to acknowledge that there's people from across this whole state joining us today, and I respectfully acknowledge the traditional owners of all of the lands from which people are joining us. As outlined at the beginning, we've got several speakers that will make some short presentations today about aspects of COVID-19 preparedness, and we will then have an opportunity for some questions, Q&A panel, so there'll be an ability for you to ask questions within today's chat, and we encourage you throughout the presentations to put any questions in the chat box. The questions will be moderated. This is purely just to ensure that there are no double-ups in the questions, and any questions that we don't get to today will be answered and published on our website. And I'd also like to encourage you to like any of the questions that appear in the chat, as this will assist us in prioritising the questions we answer. There may be some questions that we are not able to answer today, and we'll also be able to take those on notice and provide them at a later date. Without any further ado, I'd like to get to our first presenter and hand over to the Deputy Director General from the Department of Premier and Cabinet, Amanda Pickrell.
Yeah.
Okay.
Good?
Yeah, I'm good.
Okay.
Thank you, Mark. I'd probably have to start by saying I'm not Amanda Pickrell. Amanda's just been pulled into an urgent meeting, but she should be here later on. I'm Harinya Bogle, I'm from the COVID coordination team, and I'll walk us through the presentation on proof of vaccination. Firstly, I'd like to acknowledge that we're meeting on the Wajak Nuga Bhuja lands this morning and pay my respects to elders past, present and emerging. Thank you communities for organising this forum and inviting us to speak to it. As you mentioned, I think Mike, there was quite an important announcement made yesterday, which I'm sure people will have questions about, and we'll attempt to answer what we can about some of those settings later on. And I also know that we've had a lot of questions from the sector and broadly across industry and community about some of the settings around close contacts and testing and isolation definitions, which some of those details are still being worked through. What we can talk about today is when borders are eased further, what public health and social measures will be in place. These are a critical part of our safe transition plan, and particularly about proof of vaccination, which is a bit more of a newer concept and newer setting than what we've been used to over the last few years. So I might launch into that if that's okay. If we can change to the next slide, thank you. Just sort of quickly, we've all heard the term public health and social measures now, or as we love an acronym, PHSMs. These are, as I said, a key part of the Safe Transition Plan, and a lot of these settings are things that we've been used to in our COVID journey. Masks, checking in, things like density limits, which apply in certain venues, events, etc. Proof of vaccination is obviously something, a setting that's come in only in the last sort of 6 months or so, since vaccination programs sort of have escalated within Australia. Why is this important? Vaccination assists with lowering transmission, so it's got a community benefit, but also if you do get COVID, it has an effect on reducing the severity of disease. So it's a very useful and provides two advantages against COVID, and that is sort of the basis for the proof of vaccination policy. We can go to the next slide, please. Thank you. You would have probably a couple of weeks ago now, I think, time moves fast in COVID world. The Premier made the announcement about quite broad proof of vaccination requirements that will kick in from later on in January. Now I know this might not be something necessarily that affects the community sector directly. However, you all play a very integral part in spreading the message about how important this is, problem solving for people who have issues if they come across issues when this policy is implemented. So I think that was the reason why we thought this was quite important, quite an important policy to draw attention to in this forum as well. Where particularly given the broad application of this policy when it comes in later on this month or early next month. Where will proof of vaccination requirements apply? It's all published on our website as well, and we can certainly provide further information if needed, but essentially it'll be travel, both for domestic and international, a range of hospitality venues, restaurants, nightclubs, Crown Complex, stadiums, bars, pubs, etc. Events which are deemed to be sort of the higher risk events, so indoor events and certain music events as well. It'll apply in gyms and fitness centres, zoos and amusement parks, and also visitors to residential aged care and hospitals. So these are all environments where the Chief Health Officer and Health are of the view that it is useful to ensure that people who are attending these settings are vaccinated for the reasons I've specified earlier about the advantages it provides against reducing transmission and disease severity. There's, we can go to the next slide, the next one. Thank you. There are sort of two components to proof of vaccination. What can you show as to show that you have been vaccinated, and in certain settings proof of ID is also necessary to ensure that we can tie up a vaccination certificate with who you are, just to make sure that we try to minimize behavior that might be undesirable in the vaccination space. We've tried in coming up with what is acceptable, both from a proof of vaccination sense, but also with the proof of ID, to make it as easy and expansive as possible. We don't want this to be a barrier for people getting into places when they are vaccinated, just because they can't access the necessary evidence in an acceptable form, because we've made it too restrictive. So both with proof of vaccination, we've tried to be as broad as possible. So how can you show you're vaccinated? You need to get your vaccination certificate or immunisation history statement from Service WA. Once you have that, that can be showed in a number of ways. There's Service WA, which people would have heard about, which has been launched by the government, which is a free app where you can download your vaccination certificate to, and that sort of ties it in with your contact registration Safe WA check-in as well. So it's quite a convenient method to kill two birds in some settings. But you can, I mean, we certainly don't want that to be the only way. People don't have smartphones and for a variety of other reasons. So any way that you can store your vaccination certificate on your phone, you can have a paper copy. We have, as I said, tried to think of ways to make this easy for people. The only, with certain types of proof of vaccination, you do need to show proof of ID. If we could go to the next slide, I think, yeah. Oh, actually, maybe there's no slide. There is a long list of proof of what acceptable proof of ID is. It involves everything from your driver's license. It doesn't need to be photo ID. It can be your rates notice, I'm pretty sure, your electoral papers. So anything that's been issued by a government department with a government logo. There's a long list published on the website, and if we could probably actually circulate that list as well, if it would make it easier. What I will flag, and it's probably something that's relevant for relevant for this sector, is we do appreciate that proof of ID and even getting access to your proof of vaccination might be difficult for certain cohorts, and we're doing some work in exploring, particularly with the proof of ID, which is within our control, whereas the proof of vaccination is a little bit out of our control because that's controlled by the Commonwealth. But particularly in the proof of ID space, we are doing a piece of work to identify, even with our expansive list, if there are any barriers and what our options might be to expand that list further. So if anyone listening in know of any particular issues with acceptable forms of ID, we'd be very keen to hear about that so that we can factor that into that piece of work. Just going back to the slide we're on, in terms of what our obligations are, it's a mutual obligation that's imposed by that will be imposed by the directions. The obligation is both on the business to check your proof of vaccination, but also on the individual to show your proof of vaccination. So this is very similar to your contact registration obligations on both premises and individuals. So it is a familiar concept we've tried to carry through just because to make it easy for people. Probably one of the important things to point out that other than for other than for travel, the proof of vaccination requirements apply to 16 plus, not 12 plus, despite the fact that you can now get vaccinations between 5 to 12. The proof of vaccination requirements do not apply to that age group. Just if we go to the next slide, the next one. Thank you. I'll not go into this in any great detail other than to say we do realise that this is an additional requirement on venues, businesses and community settings to check proof of vaccination. We certainly don't want to create an additional burden, which is unreasonable. So we don't expect, somebody to be standing at the door necessarily checking everybody's proof of vaccination. So what in-scope venues have to do are take reasonable steps, and these are outlined as well. So it is, I think I'll just round off by probably saying it is a very important public health and safety measure. Proof of vaccination, it'll apply broadly in lots of social settings that people, enter in everyday life. I'm sure there'll be a lot of questions about this. We're trying to, there's a range of sort of a toolkit and information on the website that our comms team have developed. So I would certainly encourage everyone to go and look at those. Again, if there is something that you think would be helpful in communicating to your sector about this requirement in terms of communication tools, please let us know, and we can work on seeing what can be done to improve that. That's it from me, I think. Thank you.
Colleagues at DPC for that information. I would note that we will make all of these slides available to participants following the webinar today as well. So you will be able to access some of those, and DPC will be remaining with us to answer some of the questions in the Q&A session a little bit later. And without further ado, I'd like to hand over now to our colleagues in health and introduce Tudor Codriano, Incident Controller, and Kylie Mulcahy, Planning Lead from the State Incident Control Centre. So thanks guys for joining us. Can I just get DPC to mute their room, and we'll get health to unmute. Thanks.
Good morning, everyone. Can you hear me there?
Yep, great.
Thank you. Good morning. Just a little point of clarification. Kylie Mulcahy is not with us today. I have Catherine Flower in her stead. Just that it's a very busy morning in the Department of Health, and we'll try to cover all the requests that have come to us in the last few hours. We need to share a bit our screen if we can.
We've got the slides up for you, Tutor, so just let us know when you want to go to the next.
Yeah, okay, well, the next one, I think yep. Okay, look, what has happened in the last few days, well, last few, weeks and certainly last few days, many sectors have come to us asking questions. We just came from a meeting with with Volga, and a list of 400 questions were submitted to us to answer. What is very clear that there are themes that are coming out of all these questions, and anticipating one source of truth which will be available from the department on a website. I think it's absolutely crucial that everyone around in this meeting understands that what we say today is the truth at the time of stating it. It has information policies, processes have changed, not even by the day, maybe by the hour. And whilst it shows the direction in which the changes are going, it is nowhere near where we are going to land. And this is based not on, certainly not on lack of work or lack of planning, but it's about the information or the data which informs that planning. One of the questions that has come time and again, it's about testing. Going forward, what PCR will look like, what rat test will look like, who's going to do what, when, how, etc. There are things that have not changed, and that is the PCR remains the gold standard for testing and diagnosing of infection with SARS-CoV-2 virus, whether it is Delta, Omicron, or any of the variants that we had in the past. And unless very, very big changes in the structure of the virus happens, it will likely remain the test that we have at the moment. The kits that we have, reagents that we have will suffice to test for those infections as well. However, PCR whilst it is the gold standard for diagnosis, is not an infinite resource. It cannot be done at home, it cannot be done on the street, it cannot be done other than in a healthcare setting, and requires not only a printout, but also that printout needs to be read by somebody in the know. So it's not something that can be transferred into the community. And this is why the next second best is RAT, the rapid antigen test. There are three caveats to that. The first one, The first one is the sensitivity and sensibility of this test obviously is not at gold standard levels. There are a number of kits approved by the TGA and ATAGI on the website. And of course, those who are going to purchase them for their own use should be mindful of what is approved. And also on that list of approval there is a list of their sensitivities and sensibilities. So obviously some range from above 95%, which is very good, down to something just above 60%, which is not that good. So this is the first thing. The second thing is that the utility of this test is very much linked with your infectious period. And we know that this test will become positive around about 2 days before the peak of infection, whether you are symptomatic or not. And you can still have a positive test maybe a couple of days after that. But certainly, a RAT test is not usable like the PCR test to pick up previous infections or historical infections like your PCR does. So this is the second caveat. And the third caveat is that whilst it is, let's say, easier accessible because you can do it at home, the honesty level in people reporting the results and acting on those results is completely different from the PCR, which is done, and essentially that honesty is taken away by the lab, by the reporting system. As a small corollary to this, and perhaps not that small, is the fact that PCR rat testing in the absence of widespread community transmission is of little use, again, because of the three caveats which I've said previously. So if you were to test every 2 days or every 3 days or every day on something that is not 100% accurate, you will catch up that infection at some point. But that is incumbent on having a lot of infection in the community. Therefore, you are going to pick up something. Otherwise, it's a waste of resource and it helps no one and nothing. Now, this is the theory. I'm pretty sure that the questions in your minds are also, okay, who is going to use what, when, and whether we can start doing it now, and who is going to do it, and who is going to pay for it, and who is going to distribute it, etc. Today, as I speak, I do not have the answer to your question about what the government may provide free of cost or low cost, and to whom. This information is not because nobody thinks about it, it's because this information is being finalized and, as I said, is going to be made widely available once it is confirmed and defined. What we will do in the face of increased community transmission expected in the future, in the near future, is because of the lab testing capacity is limited, as I said, for the factors identified before, we will move from PCR testing to rat testing. However, the time of that pivoting moment is to be decided based on what the situation on the ground is going to be, and based on what we want to achieve. So whilst maybe this is not the answer that you wanted to hear, that is, at the moment, I do not have an answer for you. I think this is the answer that I do have for you. And that is, there is no doubt, once we will know that the change has to happen, everybody will be informed, and very likely not going to be a 1 hour old information. It's the trend that is going to be shown in the cases that will be in the community, and that will inform the decision time for moving from PCR testing to rat testing. Next slide.
No, they've already gone one ahead.
Oh, there you go. Tracing. Again, another theme that came out of all the questions that we have been asked is about what is the tracing going to look like? What is the close contact? What is a high-risk close contact, low-risk close contact? What is the casual contact? And what are we going to do with them, about them, and how we are going to manage them? Again, it's a case of matching resources with demand. We will start with the best that can be done, obviously, but once the numbers will be in such levels that we will have to prioritize, and to use a colloquial term, to get the biggest bang for the buck that we put in terms of looking at high-risk close contacts more closely than to low risk, and certainly the casual contacts will be less of a focus, just because spending time on looking after this cohort will be counterproductive vis-a-vis the high-risk close contacts. Now, definitions, I'm pretty sure that you know from National Cabinet that some states have already, this topic has been discussed in the National Cabinet, and some have adopted the National Cabinet AHPPC guidance on what and how should be called the close contact, high risk, low risk. WA is not at that stage yet, and what you read on that screen is what the CDNA at the moment is recommending as definition. However, again, we are not at that stage yet, so we make no difference as I speak between high risk contact, close contact, or low risk one. And again, once we end up having high community transmission in the community, we will align very likely with the CDMA at the time, because it will make very little sense to be different at that stage. Again, this will be communicated to all in good time. Essentially, when we know, you will know. That's where we are in it. Next slide. Yes, Karen. Yep.
Thanks. So in terms of outbreak response here at the SHIC, we've worked with a lot of your peak bodies, government departments and other stakeholders and businesses over the last 18 months now, developing state level strategies for how we're going to manage outbreaks, particularly in high risk settings, and how they can be managed. Those are all premised on the emergency management principles, which is essentially decisions and actions are best taken at the lowest level possible. Now, we've learned a lot from over East in recent weeks and how they're managing their outbreaks. And we're considering how, again, as Tudor said, SHIC resources can be best utilised and prioritised. There is an expectation that businesses should have developed their own COVID response plans or business continuity plannings or workforce surge planning to define those processes and procedures. Lots of people have asked, what should we do if we have someone who tests positive? And the answer to that question is, what does your own COVID response plan say? So there will be a new state level plan that's going to be made public in the coming weeks, and that's going to outline the principles for how can SHIC help when businesses, workplaces are facing outbreaks. But I just want to be really clear, this doesn't detract from your own individual business planning. This is a state level support and how we might help. Again, that will be graduated, as we've said there. There will be instances where people are able to manage the outbreak themselves because their own business continuity planning is good. There may be some instances where you might need some stakeholder advice or someone on the phone to help, or perhaps some resources. And then there is the SHIC outbreak management team, which is a slightly more comprehensive response, particularly around, for example, a significant outbreak in an aged care facility or a remote Aboriginal community, for example. But we are strongly encouraging right now, there's lots of things that people can be doing. So let's look at your planning. You know, do your staff know what to do if they become a contact or a case? Look at your workforce contingency planning. How are you going to operate if you have reduced staffing levels? What are your avenues for casual or labour hire staff? Look at your IP&C practices. Make sure your training is refreshed. People clear on the right way to don and doff PPE, mask wearing, etc. It's difficult at the moment, I know, but without the guidance, but think about how you're going to access testing for your setting. And the other question we've had a lot on at the moment is about PPE. If we move to the next slide, PPE can be accessed, as it has been throughout the pandemic, through different pathways depending on your organisation. And on the screen there, it shows you if you're a disability service provider, the Commonwealth have an avenue for you. Contractors, partners to WA Health like Silver Chain, there's an avenue for you. And then there's an avenue through Department of Finance, as you can see there, for other government agencies and third-party providers. The other area that people have been asking lots of questions about recently is cleaning. So cleaning is the responsibility of the facility if you've had an outbreak. There is lots of advice online on Healthy WA website, and we can send some links out afterwards if required on the best way to do this. So this following the exposure, just general environmental cleaning in the home and the workplace, what to do for rideshare vehicles, etc. So there's plenty of advice available at the moment online. If we move to the next slide, in terms of there are other supporting guidelines online that people may not be aware of in relation to some checklists and some suggestions for what to do in congregate living facilities. There's some flowcharts for service providers in terms of mental health, hostels, etc. So there's plenty online and more is coming. We're aware of the very long list of questions that we've been asked ahead of this webinar. We can't get through everything right now, but we will do our best to get through all of that and provide the information through. And if there are gaps, we will make sure we fill them. Tudor.
Yes, I think it's absolutely critical, just before we move forward, it's absolutely critical that there is an understanding of the pivot that will happen from when either the borders are opening or when we have outbreaks in the state. Up until now, the SHIC was able and still is able to respond to individual outbreak and guide and help and provide OMTs, outbreak management teams, for discrete events. If we are going to talk about 100 aged care facilities and God knows whatever else will come our way, I think it stands to reason that SHIC does not have the resources to allocate an outbreak management team for each and one of these instances. Therefore, the pivot that Catherine was talking about here is absolutely crucial to be understood. The state level expects, in line with emergency management principles, local response to start first and be escalated in a scalable, proportionate manner to regional and then to state level for assistance. Noting that assistance might come in the way of advice, support, and very unlikely, to use another colloquialism, boots on the ground, just because we do not have them sitting on the shelves waiting to be deployed. So this is the time, as Catherine was saying, to look at your own local plans, to look at what you can absolutely get right in terms of your your workforce, vaccination status, your PPE, alternative ways to get to work, let's say avoiding public transport if it's the case, alternative rosters for people, or to stay in separate or in not common areas, etc. There is plenty that can be done to mitigate, because the hierarchy of protection starts at the front door, and it doesn't start at the state level. It starts at your local level, how you implement all the measures that are available to you. And these measures will also keep you in good stead, not only for COVID infection, will keep you in very good stead for flu infection and for anything that looks like, like a viral infection that is transmitted in the same way. So it's not a waste of time to do it, because the rewards will be certainly worthwhile. Additional information, well, this information is, as I said, it is there. It is as accurate as we can make it, as much as accurate as we know it. But reading it today, it doesn't mean that it's still going to be there tomorrow, or is not going to change by tomorrow, just because of the pace at which changes are happening. It's the nature of this pandemic, is the nature of the virus, is the nature of how information comes. And if you go back maybe a couple of years and look at how initial chaos and how to say murky waters were when the SARS-CoV-2, the Wuhan virus came out and nobody knew anything about it, and then everybody started to study it. All the studies and all the data came out more or less at the same time. The same is happening with Omicron. So now everybody's focusing on what is this Omicron doing, how it looks like, what the outcomes are health-wise and society-wise, what we can do about furloughing and how many days we need to do the furlough. All these things are informed by data that comes out, and this data comes out fast and thick, not only from Eastern State, but also from the rest of the world. And it's validated data which informs the changes that have to happen. So I cannot emphasize enough, what we say today is as good as 12/16 on the 21st of January, maybe completely, well, not completely, but different tomorrow. There are things that you can do. Make sure that vaccination is up to scratch to those who are eligible. And remember, there are, the state clinics accept walk-ins. You do not need to have, a booking for that. Being a walk-in, it might be that, yes, you are accepted to go and get vaccinated. It might not be instantaneous. But, if you do the right thing, I think we'll be in the best stead we can be to open up when we open up. That's all from me.
To our colleagues over at Health Tutoring, Catherine, thank you for your presentation. And just before I hand over to our next presenter, I'd just like to say that we've been receiving a high number of highly technical and specific questions coming through, particularly around the application to vaccination mandates and testing requirements. Just a note that we might not be able to get through them all today, but we will endeavour to get answers out in the next couple of days. Okay, now on to our next presenter, and over to Tammy Matra, from Director of Emergency Services from SWIC here at the Department of Communities.
Hello everyone, and yeah, thank you everyone for your time. It's really a clearly and very important time for us all to make sure that we've all got the most current and up-to-date information. As Tudor has said, the information today is where we're at this point in time. I just thought I'd take a couple of minutes to explain the role of the State Welfare Incident Coordination Centre in the COVID pandemic and the response. With regard to community's role in emergency management, we are responsible for providing the coordination of the emergency welfare services in respect to for 28 hazards, and this is for the 8 hazard management agencies that are identified in the Emergency Management Act. As you'll see there on the slide, we're all very familiar with DFES's role with cyclone, fire and flood. I'm hoping that you're all very much aware of the role of communities in respect to standing up welfare centres and evacuation centres in those natural hazard events. However, you'll see there that Department of Health is a hazard management agency for heatwave, hazmat and pandemic. So therein lies the next slide, if I could, please, where with regard to health being the HMA for the pandemic and our role in the state support plan is that we're responsible for 6 emergency welfare domains: emergency accommodation, emergency food, personal requisites, personal supports, financial assistance, which again, you're probably very familiar with that with regard to fire, flood, cyclone, and the registration reunification. Next slide, please. So with health being the HMA, we were activated in February 2020 to support health's response to the COVID pandemic. In April, we actually stood up the State Welfare Incident Coordination Centre. My understanding is this is the first time that the SWIC has actually been stood up and activated. And this was because it was a statewide response that was required and a significantly new and different response that we were needing to prepare for and respond to in the first instance. We operate under the direction of the HMA. I need to make that point quite clear. So the role that we play is under the direction of the support services the HMA, as in Department of Health, require us to deliver on. To date, we've been working, we had the 13 COVID hotline, and we actually on that line, we have there's a menu option there for the community's COVID support line. This is operated 9 to 5, 7 days a week. And we have expanded that when there's been actually outbreak management required. We've been providing emergency accommodation for people who don't have suitable premises to self-isolate. This is determined through an infection control criteria and again determined by health. We've been supporting people who have been in SHIC's hotel quarantine. This is in relation to not so much the food in the SHIC hotel quarantine, but clothing and other personal requisites. For people who are self-isolating, it has extended to us providing them food while they've been having to isolate for the 14 days. We've also been linking people through to personal support services when they're unable to access their own usual support services. This support is subject to eligibility criteria, including hardship assessments. We've been supporting SHIC with the hotel quarantine fee exemptions, and at the moment we're preparing the policy and the delivery of a test isolation payment scheme, which is it's still anticipated to come online on the 5th of February. We have very much been working side by side with the SHIC with the preparedness planning and with the planning around all the vulnerable cohorts to support vulnerable cohorts in relation to outbreak management that we have been doing and preparing for when we have broad community transmission when borders are softened and opened. That's it, Mark.
Thank you, Tammy. Grace, and now I'll pass on to Elaine Patterson, our Executive Director of Contracting, who will give us a very quick overview.
Yes, I'll be very quick. I was going to say good morning, but it's now good afternoon. I just wanted to kind of give a bit of reassurance to some of our community service organisations. We have all been on a bit of a journey over the last couple of years with COVID, and things do change very quickly, as we all learned last night. So some of the questions you have today might be a bit different from what you were thinking about yesterday. But what I wanted to reassure everyone is that we will continue to be working with community service organisations through this, that we will be continue to provide as much support as we possibly can. We absolutely recognise that it's some people out in the community who really need our help and support, and we need to carry on delivering those services regardless what happens with COVID. So we'll be working with you on that to try and make sure the services do continue regardless of what's happening. Now, we've already started some conversations with some of the providers about business continuity planning. And as was mentioned earlier, some of that's changing, the situation's changing quite rapidly, so your plans will probably be changing quite rapidly. But we'll continue to work with you, and if you identify issues again, just work very closely with contract managers and we'll try and work through them together. We will also be making sure that we prioritise making payments to organisations, even if we've got our own business continuity plan within communities. So we'll be looking to make sure things like that always continue. So there's no risk of that. We'll also be looking to see how flexible we can be. So I know someone had asked a question, could we move a service to online and not do face-to-face? If that's a practical and reasonable thing to do, yes, we'll be working with you and making sure those kind of solutions can be enacted. So we will not be pinging you if there's a certain KPI you didn't meet because there's already been an outbreak in one of your services. So I think that's probably the main message I wanted to sort of leave with you, working with you and trying to make sure that the services do continue and the people on the ground that really need the services continue to get them. Thank you.
Thanks, Elaine. And our final speaker for this webinar today, it's a hand over to Rachel Seward, Acting CEO from WACOS. So Rachel, over to you.
Thank you. First off, I'd like to acknowledge the Whadjuk people of the Noongar Nation. I'm speaking here on Buraloo. I acknowledge elders past, present and emerging, and also that I'm sure everybody participating here is aware of the potential impact of COVID on our First Nations communities. I think it's fair to say that probably most of the sector listening today is probably relieved that the border opening has been postponed and moved from the 5th of February. That's because most of them won't feel ready or weren't feeling ready for the 5th of February. I've got to say that is not through the want of trying. We've had many questions which we have put into various departments and specifically a long list to DPC of the range of issues that the sector is grappling with. So we are really trying to get prepared. I think the WACOS has demonstrated, the sector's demonstrated for the last 2 years its willingness to work with government. There's a track record there. And I know Louise, our CEO, has been working tirelessly on this issue, and it's consumed, certainly since I've been here at WACOS, it has consumed most of her time, and since I've been acting CEO, it's consumed most of my time. One of the issues is the sector feels that we haven't been able to get the answers to specific questions about how we operationalise things. So when we're talking about BCPs, it's very difficult to nail those down when there's so many unanswered questions. We have been working very constructively with the agencies, and we're really pleased to hear what Elaine was just saying about contracts. We've been working on, and there's a map, a process map that if organisations haven't got them, it's readily available, it's readily available around the process for continuing service and for what happens with contracts. And so we're really pleased that the government's been working on that very constructively with us. But there's a whole range of issues that are still to be resolved, that the sector needs to know, and you'll see that, as I said, through the questions that we've already submitted, and also through the questions that are coming through today, but also the interest in this webinar and the interest that has been shown in other webinars, including the ones that WACOS ran recently on how to have a conversation about vaccination. We've done a lot of work in this area of proof of vaccination and the vaccine mandate, and our sector has been very responsive to that. But there's a lot of unanswered questions that we are seeking answers for, and I think we're going to have to continue these conversations. There's obviously access to rats, and it's good to know more are coming, but what the sector needs to know is how freely are they going to be available? Are they going to be made available freely to services and to their clients? Same with PPE. It's good to know that we're getting more PPE, but the demand is high, and I heard yesterday from one of the peak organisations that it was told, think of PPE and then triple it. That's the need. The issues around vaccine mandate, proof of vaccination, congregate living, yes, there's some guidelines being put out, but we've heard that the feedback to WACOS is that they're not, they're very good in some circumstances, but there's more work that needs to be done. There's increasing demand, what we're already seeing in the community, and we're indicating that we'll probably need more access to ER. Now, the government's been very, they've got open ears to what we're saying, that's great, but we need to get these issues dealt with in the time that now has been bought by delaying the opening of the borders. And I know some people really want to know when they're going to open, but that gives us time to really get prepared and address these questions. So we're overall really, we know there's been a good working relationship. We've had a good working relationship. We want to continue to work with various agencies, have clear lines where we can go to, because that's one of the issues that we've been hearing, is that it's sometimes difficult to know where to go. And I understand there is going to be some more clear contacts provided to organisations. I'll be quiet now because I know that there's lots of questions that people want to get to.
Thank you, Rachel. And I think you probably gave us an insight into some themes of the questions that we'll see in the next kind of half an hour as we move into this Q&A panel now, which we will do. I'll be asking Nikki Coslin to read out our questions and we will answer them to the best of our ability through the panel. But please note there's 834 people online at the moment, and obviously with 834 people there's a lot of questions. And as I mentioned at the start of the webinar, we will endeavour to get through as many as we can do. Those that we can't, we will be looking to provide answers to them out of session. And if you feel that your questions have not been answered when we do try to answer them, then please reach out to us following this webinar, and we'll do our best to follow up. So with that said, I'll hand over to Nikki and she will start reading out some of the questions.
So the first question is, we've received advice that storing vaccination certificates may put us in breach of the Privacy Act, as we are capturing and storing information over and above what is required for the purpose of proving vaccination status. Could any of the panel please comment if they are aware of this? And if so, does anyone have any advice about managing this issue that does not include the large administrative burden of redacting and uploading documents every time the certificates are updated? And linked to that, there was one question about whether community service organisations were required to use the Safe WA app, or whether they could continue keeping their records as they have been previously. So I'm not sure if that's a DPC or...
Let's start with DPC, to our colleagues over in DPC to start with.
It probably just depends on which setting and how you're uploading it, but my understanding of the directions is as long as you are collecting that proof of vaccination for the purpose for which is required, which is to record someone's vaccination status, you are not breaching any privacy requirements. And for so long as the only people that have access to that proof of vaccination are the people that require access to that proof of vaccination as well. So those records should not be shared widely.
Great, thanks, Amanda.
This one will probably be for DPC as well. There are a number of questions about vulnerable groups and accessing ID. So, for example, Aboriginal community members, young people, transgender and non-binary people. How will they be able to proceed with the proof of vaccination requirements if they're not able to access ID?
Thank you. I think my colleague Harinya might have mentioned this during her presentation, but we are actually doing a discrete piece of work on this with the Aboriginal Engagement Division here within DPC to determine some options for people for whom proof of identification is a challenge. Thank you. This has been raised in several stakeholder forums we've had in the past couple of weeks, including one on Tuesday with our CAMS colleagues. So definitely front of mind for us, and we'll get some advice out as soon as possible.
Thanks, Amanda.
This question is from Michael Pugh from St Patrick's, one of our homelessness services providers. He is supportive of the latest changes to the border settings, but an area of very significant pressure for them and across the sector is workforce. There's a desperate need for us to recruit outside of WA for qualified and experienced staff, given the lack of such available personnel available for recruitment in WA. There was some cause for optimism given the reference to exemptions for provision of specialist skills not available in WA, but it is important to urgently clarify the detail and processes around this, the scope and potential application to roles in the community sector to allow us to confidently pursue recruitment outside of WA. I'm not sure if DPC wanted to comment on that.
Yeah, so that's great. Thank you for reading the detail in the announcement. So the provision has been made for those skilled workers, acknowledging that there are several sectors that we know that have been waiting on skilled workers that were due to arrive on the 5th of February. So that provision has been provided for in the current advice and directions around the interim border settings. We are hoping will be released early to mid next week, which will provide further advice on that. But really all I can suggest is that you put your application forward to G2G. There's no specific industries that are captured within that setting. It's open to all sectors. So I encourage you, I guess, to use that pathway, noting that of course those workers will be subject to the 14-day quarantine provisions and the other requirements under the interim border settings.
Amanda.
This might be a question for the Department of Communities to answer. For children in out-of-home care and the care of the CEO, is there a way that we could get COVID vax proof in bulk rather than trying to get each child set up on Services WA? It would be helpful if health and communities could work together on this issue.
Want me to take that one? Look, that'll be certainly something we can explore with health. Obviously, the arrangements, and particularly the MyGov arrangements and access to the vaccination certificates through MyGov and the eligibility and age eligibility for children to access that comes into play with this as well. So we'll certainly look to discuss some of that with health and how we might be able to do that. But just encouraging everyone wherever possible, if children in out-of-home care have had their double vaccinations, then please speak individually with their departmental case managers about getting some copies as soon as possible.
Okay. This question might be for Elaine. Are there any obligations from funders that organisations are to advise of any positive cases?
Yeah, there's set advice that's already went out, so we can recirculate the advice that comes from the Department of Health, because I know that there will be lots and lots of questions, and it does feel that lots of unknown, but when you look back where we were 2 years ago, there actually probably is a lot more advice than there had been then, so we'll dig that back out and send it back round again.
And probably linked with that is, will organisations be assisted with purchasing PPE, cleaning materials, etc.?
The Department of Communities, the intention at the moment is that we wouldn't be necessarily funding or purchasing any additional PPE at the moment. Obviously, some of that situation may change depending on circumstances. There are also already advice and things about additional cleaning, but if there are issues for individual organisations, I would say definitely talk to your case manager and we'll try and deal with the issue on a case-by-case basis.
Another one for you, Elaine. Contracts with the this is regarding contracts with the Department of Communities not being met due to temporary COVID illness, medium term and extended period of illness in the community and workforce, coupled with long-term labour shortages of workers and cost escalations. Will the provider agency lose funding or have funding taken away or adjusted? And they've said in particular block funded contracts.
At the moment, there's absolutely no intention to take funding away if there is the reason that you can't deliver the services because you can't get workforce and things for staff. But we will have to work through those issues as they come up with each individual service provider. And that's how we'd be encouraging you to look at your business continuity plans and think about how you're going to deal with those circumstances. And then we'll have discussions as the kind of situations arise.
Sure. I'm not sure who can answer this question. Perhaps we can throw to our colleagues at Health. But in the event of an outbreak within a residential service, for example, a women's refuge, a youth accommodation, homelessness or a housing project, what role specifically would we expect the Department of Health to play in the management of that incident?
Hi, it's Catherine here. That's what I alluded to in the presentation earlier. In the coming days, we're going to be providing a plan that articulates, I guess, the principles around what state level supports may be available in various outbreak situations. So information is coming.
Thanks, Catherine.
Sorry. Regarding mask exemptions for people with disability, is there any further clarity that we can provide on what is acceptable proof of mask exemption? Is it a letter from a GP clinician to be carried by the person with disability and presented at venues?
So, yeah, maybe if we start with Catherine first.
Yes, my two experts on that have left the room. I'm really sorry, so I'll have to get back to you. That's something that will come possibly from the Chief Health Officer's office, but I'll take that one on notice.
No problems, Catherine. And is there anything you wanted to add, Amanda?
Sorry, yeah, no, we would be relying on Chief Health Officer advice for that one.
Okay.
Thanks.
There are a number of comments about people asking how they're going to get the information from the webinar because they're not funded through communities. So they're concerned that we won't have the details. I just wanted to reassure everybody, if you have joined on Microsoft Teams, then we will have your email address so that we can get this information out to you.
And can I just add, sorry, I'm on the other side of the room so people can't see me, but we'll also send all this information to all the peak organisations. So please talk to your peaks if you can't find access.
Community transport services, which are subsidised, do not appear to fall within the public transport, rideshare or community care directions. However, these services transport multiple community clients at a time, some of whom may fall within the vulnerable population categories. Aside from mask wearing mandate, can anyone comment on if community transport services fall within any other proof of vaccination direction for clients and or drivers of community transport services?
Hi, I'm really sorry, it's Catherine. There's probably another one that I need the Chief Health Officer office to go through. There are so many directions and I'm not an expert in those, so I'll take that one on notice.
No problems, Catherine. We do acknowledge that you've had some of your colleagues leave and you are there by yourself, so we do acknowledge that and happy for some of these to be obviously to be taken on notice.
There are a lot of questions coming through that are sort of in a similar vein that we'll have to take on notice and get the Chief Health Officer's office to provide a written answer to people. That's probably it without the Chief Health Officer's advice based on the questions that we've had submitted. So I'm not sure if you guys wanted to make a comment about anything else.
Is there anyone from the table that wanted to make a comment about anything? I suppose what we've just, what Nikki was just saying was that given the technical and health aspects of the majority of the questions that we have left, that unfortunately, Catherine, will be all kind of coming your way to seek Chief Health Officer advice. The ones relating to vaccine mandates, we have already tried to answer, and thank you to Amanda and her team for the answers to those ones as well. Before I open up to see if any of the presenters wanted to make any questions, Rachel, Catherine, Amanda, or anyone around the table, I would like to say that, I understand that, part of these questions will help in your planning, but I just encourage everyone to use this time that we have now to continue to prepare and plan as much as we can, and just ask if any of the fellow presenters had anything else they wanted to say from today. And Rachel, I might start with you. Is there anything further that you wanted to say, or possibly even ask yourself?
Yeah, I think there's some of the, I take on board what we're saying about the detail of some of the technical issues, but there's some of those big picture issues that in terms of timelines, for example. So some of the issues around definition of close contact that were raised earlier. What is the timeline for decision making so that people can build that into their planning, into their BCPs? What's the timeline around those other key decision making, for example, the decision making over what's going to happen with rats, all those sorts of things. Are you able to, I heard what you said about they're still to be made, but are you able to give an indication of some of the timelines of when those decisions will be made?
Catherine, I think that one's...
That's probably one for me. Hi, and thanks for the question. All of those issues, close contact definition, testing and isolation protocols, how we'll define essential workforces, and as you mentioned, probably the hottest topic right now, provision of rats, how we'll get them out, when we'll get them out, when they'll be free, all those sorts of questions are being worked through with a great deal of urgency at the moment by government. We're hoping to get some decisions on that in the coming weeks. What we will undertake to do is to convene another session like this, once those decisions are landed, so we get a chance to talk to you about those and answer specific questions at that time about how you can apply it to your BCP. So we'll commit to that and come back to you as soon as we can. We understand it is a frustration.
Thank you. And I did hear the issues that you and acknowledge that in fact I have had a phone call already around the difficulties with the proof of identification. Some of the issues obviously WA can help solve, but it's that interaction with Services Australia that we're also starting to hear quite a lot of concern about.
Yeah.
What's the timeline, and is that fixable? And if so, again, what's the timeline?
Yeah, it may be that some of those big ticket items like the interaction with Services Australia, that probably are actually issues we've had for a long time and are not necessarily related to this proof of vaccination question specifically, we can't resolve quickly. But what we're trying to come up with is what are some alternative options if Service WA or that digital means of proving your identity or proving your vaccination status aren't available to people? What other options can be made available? And I guess acknowledging that that's not going to be a whole of population solution, that's going to be bespoke arrangements for those people that are particularly impacted. Yeah, we can't promise to solve the Services Australia issue, I'm afraid, but we will try to come up with a solution that is workable.
Thank you. Can I also make a suggestion, and that is I know there's a lot of technical issues people raised. I think it might be, if it's possible, to organise maybe some more topic specific, whether it's a webinar or roundtable on some of those issues, because I know that people will have further questions. There's a bit of an iterative process on some of these questions, because some of them I know are very detailed, but that they inevitably lead on to other questions. So I'm wondering if we can look at a process where the sector can engage on specific topics where they continue to have difficulties.
Yeah, and Rachel, look, that's certainly something, and I think, and thanks to Amanda for, putting that offer out for, particularly as more work gets done in that space, and we'll certainly look to do the same, because as you said, there is some themes coming out of the questions today, and actually having specific topics to discuss in this forum or a similar forum, as you mentioned, certainly as we go forward, we'll be looking to do.
Thank you. I'll also emphasise, and I'll shut up then and hand over to somebody else, but the issue around workforce that Michael raised is a huge one for the sector. We're extremely concerned about it. WACOS is doing some work on it, but I'll put it back on I want to keep it on the agenda because it is a huge, huge issue.
Yeah. Thanks, Rachel. Was there anything further from yourself or your team, Amanda, before we wrap up?
No, just a thank you to everybody. The questions and the engagement is really useful for us. So thanks very much for your time today.
Right, thanks, Amanda. Was there anything from any of my fellow panel members in the room?
I just want to say it's Bev Joel here, and I'm sorry I'm not on camera, but I've had a number of questions being sent to me by email. Just let people know I will respond and we'll log those questions as well. Thank you.
You guys, anything further from yourselves? No.
Just from ourselves, from a SWIP planning perspective, really thank you for your time today, but also the engagement and the interactions that we've been having, and particularly my colleague Natalia, with members and the peak bodies in the community sector. Because without your information and your knowledge and your input and your questions, we're unable to prepare the plans and and to have robust planning in place for when we ultimately need to respond and support. So really thank you for your input, your questions and your time, not just today, but in all the months leading up to where we are now and where we're going in the future.
Great. So just in finalising today, thank you for your questions. We'll endeavour to have those answered outside of this as soon as we can do. I'd also like, as Mike Rowe said at the beginning of this webinar, just like to thank everyone for their continued work, particularly with some of the challenges over the last couple of years. The community services sector is a significantly impactful sector, important sector in the context of all people here in Western Australia. So I just wanted to thank you for your continued work and dedication to the people that you work with. We'll use, as I said, use some time to get back to you, look at some very specific kind of webinars or sessions that are actually on some of these specific themes. And again, use this opportunity just to say continue to plan and prepare and get those booster shots in. So thanks everyone for your time today, and we'll be back in touch with everyone in due course. Thank you.